in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking more about cases. We're talking about how we serve such a function for new patients and also for people whose cancer just hasn't responded to the treatment they're getting. I want to talk about a woman who's 71 who came in just this week. She's a married woman with 2 children. She lives in New Jersey. She was just diagnosed this past year with T-cell lymphoma. So lymphomas are usually very, very, very sensitive to treatment, and usually they melt away. Well, this woman was fine until June 2013 when she developed weakness and never got better. She was a vital woman, playing tennis, having lots of friends, taking care of her family, and she lost 42 pounds. She went from about 150 down to 110 pounds. You can imagine how weak she got. She was worked up and found to have tumors in the lung. They were biopsy-proven T-cell lymphomas. And she went to one of the most prestigious hospitals, biggest prestigious hospitals in New York City. She started chemotherapy. She had tumors in the right lung, the left lung, and the abdomen. She had 6 cycles of chemotherapy between January and May, and this lymphoma, the lymphoma which I told you usually responds beautifully to treatment, progressed. It grew. It kept growing. Well, this woman is a smart woman, and she gave a half a year of her life to chemotherapy. She lost so much weight. She was having diarrhea 18-20 times a day. She decided to stop the chemotherapy. Furthermore, from the cancer and from the treatment, she was losing blood. She's had multiple blood transfusion. Her hematocrit, which is a percent of the fluid in the blood, is red blood cells. In most of us, it's about 40, 45. In her, it was down to 27. So she had this weakness, the weight loss, the diarrhea, and she decided to get a second opinion. She's smart. She didn't stay on the same treatment. She said, look, I'm not better. I can't take it anymore. I am changing my treatment. I'm going to investigate other methods of treatment. She came to me this week. I examined her records. We got the pathology. The doctors at the other hospital couldn't imagine that cancer wasn't responding, so what did they do? They did another biopsy. Well, it's okay. They did another biopsy. And what was it? Well, she was told it's something different. But in front of me and her friend, she went to the bathroom because she has diarrhea so much. I got the pathologist on the line, and he confirmed it was this exact same cancer, T-cell lymphoma. And I asked him to send over a report, and I gave her the report. She has the report. She has the PET scan. The cancer's progressing. So we proposed a totally different treatment, because if the best chemo is not working, most probably the secondary or tertiary chemo is not going to be much better and probably be worse. Usually when the cancer sees chemo, it starts resisting pretty fast. Well, this woman didn't even have a vacation from the cancer. It just got worse and worse and worse and worse. The day she saw me, she saw another doctor who told her she has 2 weeks to live. Now, this is an ambulatory, intelligent woman. She called me back and said she wants to get going with treatment immediately. I proposed that this diarrhea and the anemia were probably related to humors. Sometimes cancers produce substances which cause effects on the normal body, like this diarrhea, which has been massive and it's been overwhelming to her, and nothing that they've done has helped her. So I'm going to propose medicine to help slow down the diarrhea and cancer treatment to stop the biggest nodules of cancer first. If she likes our treatment, we will complete it. I always like to tell people they are the president of the United States of their body, and I work for the president. And if they like our work, if we make her better, then stick with us and we'll complete the job. So that's where we stand. This is a 71-year-old woman with T-cell lymphoma, tried chemo at a big fancy hospital, didn't work, got worse, lost tons of weight, lost tons of blood cells, and now she's taken a turn for a totally different treatment with non-invasive, fractionated stereotactic body radiosurgery. She's going to start on Monday. We wish her well, and I believe most likely we'll be able to shrink down that cancer. That's our goal, and we want to stop her bad symptoms, get her weight back on, stop the diarrhea, let her live her normal life. It's tennis season. Let her play tennis, take care of her family, and do the things that she really loves to do. That's our goal. We don't want to interfere with her quality of life. We want to restore her quality of life. And similarly, we had a man fly up from Texas, deep in the heart of Texas. He was born in Texas. He lives in Texas. And he flew up. Why? Because he has a Merkel cell cancer. Merkel cell cancer is a cancer of the skin. Many of you probably heard about squamous cell cancer and basal cancers and perhaps melanoma. Those are the most famous skin cancers, but there's another called Merkel cell. We actually treat all those skin cancers, and right now we have one man with 4 basal cells on his face. One's a big mass under the eye, and then there's 3 more on his forehead. We're treating them all simultaneously, and he's getting better. We have another man coming in from Connecticut every day with squamous cell cancer of his hand. So these are cancers usually caused by sun exposure. So you can imagine the hand is sun exposed, the face is sun exposed. And now this man from Texas with another skin cancer called Merkel cell cancer. Well, this man has had multiple cancers. He estimated he's had cancers for 30 or 40 years. He's estimated he's had more than 20 skin cancers. Most of them were basal cells and squamous cells. But in 2011, a biopsy showed a Merkel cell cancer on his head. He had topical chemotherapy. The cancer continued to grow. He had 10 Mohs treatments. Now, I know many of you heard Mohs surgery will make the cancer go away. Well, that's not really true. There's a recurrence rate after Mohs surgery. Mohs is like a salami slicing. They keep on slicing to get to the last cancer cell. So theoretically it should work. The problem is it's in practice. The theory is one thing. The practice is another thing. This man has had 10 Mohs surgery. Mohs can be very deforming because if they keep on slicing, it can take away a lot of normal tissue along with that cancer. Well, he had standard radiation in Texas a year and a half ago. It didn't work, really. The cancer's been growing. He's been seen by multiple doctors. They gave him 12 cycles of chemotherapy. Didn't work. The cancer's been growing, bleeding. He's had headaches in the area. So he heard about us, and he called many times, and we took all his calls and answered all his questions. So right now he has multiple skin cancers on the right side of the face. We staged him up because Merkel cell can get in the bloodstream and spread. We staged him up immediately. On the first day he came, he got seen. We got a history. We got the paperwork. We examined him. We fitted him for stereotactic radiosurgery, which is a non-invasive treatment, and we staged him up all in one day, more than he would have had most places in a month. And he is hot to get going with treatment. He will start treatment tomorrow. Most probably, and this is based on our data, we can stop or shrink the Merkel cell cancer. Most likely it will shrink in our hands. And actually we've had great results. We had one religious person who had surgery in another hospital. He got super infected from the surgery in the hospital with Merkel cell cancer, and by the time he recovered from the infection, which took 6 months, he was in a nursing home with this super infection. The cancer grew back. So the beauty of our facility, it's not a hospital. There's not an ICU producing super bacteria. You come in, get a treatment, and go home, non-invasively. So I believe it's safer, easier. I believe it's what most people want, which is a non-hospital environment. It costs less. You don't sleep. You get to sleep in your bed. You just come in for the treatment and go home, which I think is what most folks want. So I'll report back to you about this gentleman. But right now, he's hopeful, and I'm very hopeful that we can stop or shrink, hopefully make this Merkel cell go away, and then we'll stage him up. He's going to stay here for a few weeks and head back to Texas, which is his home. And he loves Texas, which is normal. Again, this is Dr. Lederman from Radiosurgery New York Cancer Treatment Center. We have something called the Urgent Cancer Consultants, where we promise to see you within one business day. We know a lot of people are not doing well with chemo. There's some of you in the hospital listening to this program. Some of you have family and friends in the hospital or getting chemotherapy or surgery and wondering why. If it's not working and not tolerated, why? And that's a question we would ask. If something's not working and it's not tolerated, why would you stick with it? For us, it seems like a time to have a fresh second opinion. And there are other treatment options, real options, not pie-in-the-sky options, real options that have a track record. We've treated about 20,000 patients. We follow our patients. We report our information at medical meetings. Last year, we reported at several meetings, both in the United States and overseas, even in China, where we gave lectures on cancer treatment and our results. We also have something called hyperthermia, which is heat treatment, which we can offer concurrently with radiation for certain tumors. We're one of the few facilities in America with hyperthermia. That it's been known since the days of Cleopatra that heat helps kill cancer cells, so it's something that we can talk about if you want. We're a private cancer treatment center, which means you come in, we know who you are, you're our boss. We're not subsidized by the drug companies or surgeons or others. No, we work for you. And we accept, of course, most insurances, Medicare, Medicaid. So we're going to hear just for a moment from our sponsor, and then we'll be right back.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD.